Okay, so are supplements helpful in people who have various fatigue syndromes? And the answer is yes, they are, and that they are probably more effective the older the individual gets. And there are various articles on this website where I talk about um, the differences and similarities between chronic fatigue syndrome and aging, and that the mitochondria in both conditions seem to be affected. But if you take a very young individual who has developed chronic fatigue syndrome, that individual will certainly have a reduced number of mitochondria in the affected organs. But it is likely that the remaining mitochondria are all going to be relatively normal. In that individual, you're not going to get that much benefit from supplementation because the mitochondria that are existing, that are working, are normal mitochondria. In older people, where you get both a lower number of mitochondria, but also a subset of mitochondria that are not functioning well, in that individual, the subset of mitochondria that are not functioning well can function better if you give them supplementation with things that the mitochondria may be missing, or with things that will allow the mitochondria that are not functioning well to get rid of some of the toxic byproducts that they have built up, and this will improve the function of those mitochondria. So what I find out in my practice is that when I give a 50-year-old supplements along with antiviral treatment and the other things that we do, they come back and they love it. They love those supplements. You give those to a 20-year-old with post-COVID syndrome, yeah, it may make a little bit of difference, but they're not going to be the people that don't want to get off the treatment after 6 months. They, whereas the older people do feel a huge difference between taking the supplements one day and not taking them the next day. So usually those are folks that we keep on for at least a year, if not longer.